the governorship election in Edo State. Dr. Patrick Okundia, MBBS, a fellow West African College of Surgeons, is the Honorable Commissioner for Health, Edo State. A specialist medical practitioner, Dr. Patrick Okundia is a consultant ENT, that is ear, nose and throat, head and neck surgeon. He had his training in the University of Benin, UBTH, and of course the University College Hospital, UCH, Ibadan, and UNTH, Enugu, with many local and international workshops. He was the head of Department of ENT, Head and Neck Surgery, Stella Obasanjo Hospital. He has headed the leadership of many medical professional associations. He was chairman, Secondary Healthcare Advisory Committee under the EdoHIP, that is Edo Health Improvement Program of Governor Godwin Obaseki. And he was serving as the medical director of the Stella Obasanjo Hospital, Benin City, before his appointment as a civil commissioner. He will be speaking on the health sector transformation policies of Governor Godwin Obaseki this evening. Dr. Patrick Okundia, you are welcome to the program.
Thank you so much, Habiba. Nice
and my name is Habiba or Yege or Yarekwa, your regular host on the program. Now, Doctor, can you give us, with the benefit of hindsight, a brief overview of the current state of Edo State health sector?
Yeah, thank you so much. Let me start by saying that I've been practicing medicine and in Edo State here for over 25 years now. And so I've been involved in all the issues as it pertains to health care, especially the healthcare delivery system. Okay. If we look at the Edo State as it is, we realize that if we need to address the challenges of healthcare delivery system in Edo State, it will take decades to address. I bet where we are today is where we're going to talk about.
So that you just give us an overview.
Overview, yes. We have made very huge leaps of progress in the healthcare delivery system in Edo State. I will just leave it as a summary. We will discuss the details. Yes. Edo State has made huge progress in our healthcare delivery system. But I must state that, like I said earlier, if we look at the challenges of the health sector, decades will not be enough to address them. But I think we are on the course to addressing all these challenges. But so far, we have made very huge positive steps.
Okay, now, what in your opinion are the major gains, the major gains by the Governor Obaseki-led administration in repositioning the health sector of the state?
Yeah.
Excuse me.
Mr. Governor, Godwin Obaseki, with all due respect to his person, is someone I respect so much because of his approach to things, saw the answer to the challenges of the health sector in Edo State when he assumed office. I also knew that rather than what was the business as usual of successive government, that palliative measures were being done, we do surface dressing. Mr. Governor felt there was need to address holistically what the issues are. If you recall that the very first few months of his assumption of office, a health summit was convened by him. And this he did to draw all the stakeholders within the state and even outside the state to address the challenges of the health sector. The health summit was hugely successful, in which we addressed to identify where the problems were, and then we profiled solutions in terms of ideas. They all came up. Now, I must state here that the product of that health summit conceptualized the bit of the Edo Health Improvement Program. And Mr. Governor decided to say, let us start with this. Edo Health Improvement Program is a tripod program that addresses very critical aspects of the health sector.
And you were the chairman of that committee, the advisory committee?
Yes, the governor also set up advisory committees on the various pillars of the EdoHIP. Now, the three pillars of the EdoHIP set down on the primary healthcare, which is the fulcrum of healthcare service and the healthcare service delivery. It is the main source where the major population of the state, the downtrodden, the poor, have accessibility to healthcare. So primary healthcare was one of them. The next was the secondary healthcare. And then the third, which is more important, is the healthcare financing. So in the same vein, he set up committees. In his wisdom, while we're driving this, he needed people from within, local content, to see how they can be part of this process. I was just a civil servant then, heading my department of ear, nose, and throat, and I was appointed to chair the advisory committee for the secondary healthcare pillar. Another consultant was also appointed to chair the advisory committee of the primary healthcare, as well as that for the healthcare finance.